tension. So you want to be very superficial here. What about doing a circumferential block? Would that be an option here?
I mean, if we're just draining it, it seems like it would be a little excessive, but we could.
Sometimes you can. So the problem becomes, so the difficulty is obviously if it's inflamed, the freezing doesn't work as well. So you can do circumferential blocks, but it's hard to say where the inflation starts and stops. So you can have a very big one. In this case, you'd be talking about a very large circumferential block. And what I think general people who may be watching these type of things don't understand is the freezing's no fun. Right. You know, that stings quite a bit. So when we're trying to minimize discomfort to the patient, you do have to factor those in. So obviously we want to be creating as little discomfort for the patient as possible, but we have to have a balance there. We don't want to cause more either. So generally we want to see, certainly where we're going to be incising, we want to be minimizing that as much as possible. And the reason why I'm adding extra, even though you're going to be just incising, you know, maybe 1.5 centimeters here, is because we're going to be using our curette afterwards to see if we can break down as many loculations as we can. You're okay?
Oh yeah, no problem. Do you want me to give you any feedback?
Yeah.
Yeah, it's actually, you were the last spot before now.
Yeah.
You're probably a little deeper.
Yeah.
So there was you can feel
felt
the
more discomfort. Yeah.
You know, just factually, it's almost like a bruise.
Yep.
It doesn't feel anything more than that, at least.
Well, what I'm going to try and do in a second is I'm going to try and get the in-between tissue. So I'm going to go a little bit deeper.
Yeah, that's fine. I'm an old farm boy from way back.
Oh, so you guys don't complain at all.
Right.
So this is where, now that I've gotten over top here, I'm just going to add a little bit deeper. You okay there?
Oh yeah.
So this is within the...
No, it may not be. So, but I'm going deeper. So I just want to be a bit careful. I don't do this initially because, again, now I'm flirting with being into the capsule space itself.
Yeah, because you can feel the pressure.
Yeah, I feel the difference.
Yeah, but it's just mild. But you definitely feel the difference. I thought because I was maybe playing with it a little bit too much that I broke the capsule.
No, you haven't yet. So, and because of that, this is why if it wasn't inflamed, we'd be taking the whole thing out, but we're just going to be rupturing this and cleaning it as best we can.
Yeah.
So now I'm going to let Dr. John step in. I'm going to switch past you here. So which type blade would you want?
Number 11 blade.
Yeah, so number 11 is our puncturing blade. We're going to grab the 4x4s. So I would warn you, so when you look at this is pretty taut, so there can be significant pressure that's there. So you're going to be going right down at 90 degrees, and you're going to want to be creating an incision about 1.5 centimeters. And the reason why, at least that's because you're going to have pressure, static pressure, so the keratin inside has to be able to be big enough to get out. If you're too small, it'll just sit there, and sometimes you have to actually extend the incision just a little bit. But I would tell you, you want to take this and just have it ready, and then not over top of it, just incise down, and be careful you're not going to splash yourself back.
So how do you do that just to make sure you don't splash?
It's like you're doing, the angles where you're at. You're good there. Little pressure here.
It's about 1 centimeter.
Yep, not too bad. Just gonna be a little bit deeper, that's all.
Okay.
Good?
Yeah.
And then what I would do is I'd extend it back the other way, just a little bit. Because you can see that it's there. You're okay?
But
All right, so now,
I think I should go to dentistry.
you want to apply a little bit of pressure on that. Just gentle, because you're going to find that it's, that's going to happen.
See? Yeah.
Good? That's why I have this right nearby.
Lovely stuff.
Yeah, just grab some other 4x4s. So clean that off, and then grab your other 4x4, and then same thing. So generally here, you're going to expel as much of that as you can, and you want to be going at that from different directions. So what I would do is just put your...
Show me your technique so that you don't
So here...
So it doesn't erode.
So what I do is... Oh no, that's just about... You sometimes you get caught with this. This is why I'm doing it here, and the actual garbage down below,
right.
And I'm not putting my face here.
Yeah, that's
what you want to be avoiding. So because you can't help it because he got so much tension, but you want to be pushing it from different directions because we want to be loosening that up. You okay? As best we can. Looks pretty good, but you can tell he's pretty firm with the keratin in there. So we'll see about how much that we can get out. Let's see, like that. Yeah, and see how that went there and not all over you.
Yeah, that's very smart. It's an excellent placement of that.
It is, yeah. But this is why I'm putting pressure down here. You okay?
Yeah.
And then we'll see how much we can get with the curette as well, which will help. So we're putting that pressure down. And this is what I'm saying to you, if we did to avoid any discomfort with this, you'd have to have a really, really large circumferential block, which he may not appreciate.
He promised me he was tough beforehand.
They all promise that.
Yeah.
So now what I would do is grab your curette. Now essentially you want to be going around essentially in 360 degrees. So you want to try, you comfortable? That's not too uncomfortable?
Nope.
Because if he tolerates, we want to break that down as much as possible. Just make sure we check base. You're good with that? Not too bad? Because that's the limitation, right? Because sometimes the...
It definitely has a lot of septations over here.
Yeah. And once you do that...
It's not as much up here.
So you should be seeing now, when we go back to it, usually we find that, yeah, you break more out because you broke down all those, see that? That's all wall there.
That's wall?
Yeah, so we want to get that as much as possible because even though we can't get it all out, sometimes you'll get a little bit lucky with it. But that's because you broke all those down. See, beforehand I wasn't getting much out, and now all of a sudden it released completely. You're still comfortable?
No, I'm fine. I want this video.
So now I do the same thing again, because we'll probably get that to break down a little bit more, and then if we can't, that's where we definitely irrigate it, because sometimes the irrigation does the same thing for us.
Have you ever seen these, like, with an infection like this, and
Yeah.
you're adding in, is that ever enough to remove it and prevent it from coming back, or does it always come
Generally not when they're big, like if you get tons of the actual capsule, sometimes you're lucky, but remember we talked about little ones will do that. If you just unroof them,
Right.
you get enough of the capsule that it doesn't come back. But these bigger ones, because this is a pretty big cyst, you can feel it's
Yeah.
decent, it'll probably come back, and that's why we'll have to
Okay.
let
Hurt
it
you?
heal.
Oh, a little bit.
It's a little
Sorry, buddy.
Yeah. So just relax that off, because that's where the limitation is, because we don't want to make them too uncomfortable. So that's why, to again see how successful that is. So then all of a sudden it's draining more, and that's why we want to break down some of those as much as we can. But we don't want to make them excessively uncomfortable. So that's why we'll, the whole debate about packing. They used to treat these like they would abscesses, and they would pack them every day for weeks on end. We don't do that anymore, but overnight I'll pack it to see if it'll break down into that space.
Right.
I'll take the packing out, and then we'll just have a normal dressing on it. But now that we've done this, now I want to irrigate it. So just grab more 4x4s for me.
Nasty smelling stuff, huh?
It's not pleasant.
And that's just what? Just keratin rotting, or
Yeah, that's because it's actually gotten secondarily inflamed and infected, so you get that process. So essentially what I want to do here is I'll do the first one, I'll do the other ones. Same thing like the curetting, I'm just introducing the fluid at different angles. Because essentially, beyond cleaning it out, I want to be encouraging that membrane to separate or for loculations to break down. Just like that. So just grab another one there and then have just below it so you can actually squirt into it. Just back it out a bit, catching it there. Now, are you worried about infecting this field?
No, it's already infected.
It's already compromised, right? So this is why this is a clean field, but patient centers will comment on the fact that, this is going in and out with the suction, but it doesn't matter because we're just trying to clean this out and it's already compromised.
Right.
So just do another one here. We got that.
what would happen if this is left untended to?
Well,
Or it's going to
typically-
the infection's going to grow, but
Yeah, the pain will get worse. Then typically they'll tend, because what's happening right now is your body's trying to get rid of it.
Sure.
So it's trying to break through the skin, which we broke through with a scalpel. That may take a few days or a few weeks, so you can have a lot of pain. But you
Right.
can also get septic, because the infection, if it can't get out,
right,
starts
stays
to,
inside and turn.
Yeah, it starts to rupture the other direction.
Right.
So once we've cleaned that out, so now I'll try again to see what that looks like. I don't expect to get much.
This is when you get a swab.
This is when we swab. So my point being
I
is,
like your analogy I heard
Yeah.
about interrogating a prisoner.
it's the exact same thing, right? We want live bacteria. So if we send away that initial stuff, you sometimes get lucky and you'll culture something, but a lot of times it's just dead bacteria. So now once we have this, so we're just going to swab this side and the other side. You're okay? And that we want to send off. And you looked at proper swab technique, it's really detailed how clean they get it. This is reasonable, but they'll be really anal with how often they clean
OR,
it.
right?
Yes, well, sometimes they don't do it like they should,
Right.
but if you talk to microbiology and how they want it, it's different. So now because this is big enough and it was, extravasing a little bit, now we'll pack it. So we'll just grab the packing. So you just want to start packing that in. You're still okay? So this you want to pack in until it's essentially full, but you're not making it terribly taut, but you want to fill that in, and that's a big space you're putting in a lot. And you want to make sure, see the tweezers you're using?
Yeah.
It's not the Adsons with the teeth, because the teeth will catch on it and it'll just be a frustration.
Yeah.
So you want to make sure you have the ones that don't have teeth on them. So how long's that spot been there for you? Like, have you had that for months, years?
Like I said, it was just something that was about a year and a half.
Yeah.
But it grew
Yeah.
grew steadily, and I didn't really pay attention. It wasn't bothering me. And then, I guess over the last 2 weeks, it's really probably doubled in size or tripled in size.
Yeah.
Probably because I was playing with it a little bit, and I tried. We popped it once before.
Really?
Yeah, I just squeezed it, and it kind of gave it a squeeze, and then it came back. So I knew there was a problem there. Didn't really hurt or anything until just recently, this last week, in the redness of the skin. So that told me everything right there.
You just keep trying to fill in these little
Yeah,
areas,
as best
I
you
guess.
can. Yeah. You okay there?
Oh yeah. The worst part's over.
Oh yeah, by far.
Now there's a sac in there, correct?
Yes, there's a membrane or a capsule.
Yeah. So when you pull that out eventually,
Yes.
is it attached, or should it
No,
pull?
so we would dissect that around the tissues. It's not. It's loosely attached, but
Okay.
it's not something that's really adhesed down.
Okay.
Yeah.
So it should come out.
Yeah. So that's something that's not a problem.
Yeah.
Okay, it's pretty.
Pretty tight. Let me just take the feel.
Yeah.
Oh, I like that. It's pretty good. There's a little bit more in this corner, but you'll always have that potential. So what I do now is I'll just pull like this, cut it at the actual, get that off, and then I'll trim it up here. So just cut that there from Loretta. Cut this here.
Okay. Here.
So I just do that so we're not infecting this end of things.
Sure.
That's clean. So